Hey guys, welcome back to my channel. Myself Vaishali Gautam, and in today's video we will talk about the drug of choice. We will talk about the drug of choice of general pharma and of ANS. Basically, we will cover all of the drug of choice names in general pharma and of ANS. So let's start the video. So here we will talk about the drugs of general pharma and ANS. So the first drug is wait a minute. The first drug is pleocarpin. The first drug is pleocarpin, and the pleocarpin is a drug of choice for treatment of closed angle glaucoma. Here the RX represent the treatment. So pleocarpin is a drug of choice for treatment of closed angle glaucoma. Now move on to the second drug. The second drug is cevimeline. The second drug is cevimeline. The cevimeline drug is a drug of choice in xerostomia. Is a drug of choice in xerostomia. Now the third drug is atropine, and atropine drug is the important drug. We learned about atropine in many more units. But if we'll talk about the general pharma and ANS, so this is all about atropine. So atropine is a drug of choice for cholinergic poisoning. The drug of choice for cholinergic poisoning, and it also a drug of choice for treatment of bradyarrhythmia. And the third point is for atropine is that the drug of choice for AV node blockers. The drug of choice for AV node blocker is digoxin. We will pronounce it in any way. This is digoxin. So we will learn about the three drugs. The first is pleocarpin, which is a drug of choice of treatment of closed angle glaucoma. Cevimeline, drug of choice of in xerostomia. Atropine, drug of choice for cholinergic poisoning. Remember one thing, that there is two things, that the drug is a simple drug of choice for something like atropine is a drug of choice for cholinergic poisoning, but the pleocarpin is a drug of choice for treatment. So focus on that, is this directly a drug of choice for the disease, or it is a drug of choice for the treatment of the disease. So this is two different things, so be careful in this. So let's move about physostigmine. So here is physostigmine. Physostigmine is a drug of choice in atropine toxicity, belladonna poisoning, datura poisoning, and the most important, that physostigmine is a drug of choice in the treatment of myasthenia gravis. So this is very important, that this is a treatment. This is a drug of choice of treatment of myasthenia gravis. Now the next drug is edrophonium. The next drug is edrophonium. This is a drug of choice for diagnosis of myasthenia gravis. So here is two things. There is a diagnosis and there is a treatment. So the drug of choice for treatment of myasthenia gravis is physostigmine, and the drug of choice for diagnosis of myasthenia gravis is edrophonium. Okay. Now next drug. The next drug is thiopentone. The next drug is thiopentone, which is used in narcoanalysis. So here it is a drug of choice in narcoanalysis. The next drug is tiotropium. So the next drug is tiotropium. Tiotropium is a drug of choice in COPD. The full form of COPD is chronic obstructive pulmonary disorder. So tiotropium is a drug of choice in COPD. The next drug is scopolamine. The scopolamine. This drug is a drug of choice for motion sickness. The next drug is tetrabenzine. Tetrabenzine is drug of choice for treatment of Huntington chorea. This is a disease, and for treatment of this disease, the drug of choice is tetrabenzine. The next drug of choice is deuterabenazine. Here is a two drugs. The first drug is deuterabenazine, and the second is valbenzine. Valbenzine and deuterabenazine. This both drug is a drug of choice for treatment of tardive dyskinesia. Sorry for the error. So this two drug is a drug of choice for treatment of tardive dyskinesia. And now let's move on the next drug. The next drug is bromocriptine. The next drug is bromocriptine, and this is a drug which is a drug of choice for cocaine dependence. So in cocaine dependence, we will use bromocriptine as a drug of choice. Now let's talk about the next drug, and this drug are the common drugs. Though the next drug is epinephrine. So the next drug is epinephrine, and the epinephrine is a drug of choice in various things. So the first is epinephrine is a drug of choice in cardiac arrest, ASCLS, the cardiac arrest. The second, epinephrine is a drug of choice in anaphylactic shock. The third is epinephrine is a drug of choice in brittle asthma, and it is also used in glaucoma. But in glaucoma, we do not use epinephrine. We will use the prodrug of epinephrine, which is dipivifrin. This is the product of epinephrine is dipivifrin. We will use in glaucoma. So the next drug is norepinephrine. The norepinephrine is a drug of choice. For vasodilatory shock. The vasodilatory shock, which is also known as sepsis. Shock. So norepinephrine is a drug of choice for vasodilatory shock, and the second is cardiogenic shock. Phenylephrine is the next drug. So phenylephrine, the drug of choice. Drug of choice for anesthetic agent induced hypertension. So anesthetic agent induced hypertension, in this we will use phenylephrine as a drug of choice, and in priapism. So this is two things in which we will use phenylephrine. So the next drug is midodrine. Midodrine is a drug of choice for postural hypotension. This is a hypotension is due to the postures. So here are the first 15 drugs and the drug of choice. So there is the first 15 drug of choice. We also have more drug of choice, but in this video we will not cover this because I don't want to make this video so long. So if you lose interest, I will keep it small and sweet. So this will help you to revise a drug in one place. So I hope you like my video. If you like my video, please like, share, comment and subscribe to my channel. Thank you.